Okay, good morning, everyone. That's a very nice introduction. I really appreciate, and I hope you don't mind if I stand up because doing presentation is much easier to like going back and forth and back and forth. So, as mentioned, my name is Phoebe Shi, and I am the Senior Wellness Coordinator for Asian American Health Initiative. AAHI is a part of Montgomery County Department of Health and Human Services. It's our great honor to be here this morning with you guys and share some information about Medicare. Just one thing I want to share before we start Medicare. At the end of the presentation, we would really appreciate if you can please do a evaluation for us. So your feedback is so important to us. We want to know what we do the right way and where we can improve. So it's going to be a QR code. It's very easy to use, and I think we are all going to help you. It has Indonesian language that you can use. You will find it's very fun. Okay, so um, we are going to share Medicare information. Medicare is so complicated because it has different parts. Now, that different parts, some is free depending on if you work 10 years, earn enough uh, credit already. And then other parts, people need to pay premium. And premium also depends on the income. So that's why Medicare is very confusing to a lot of people. So it also depends on the individual situation, the individual income, or the couple's income, or the couple's situation. So we are going to do today is just going to cover the basics. But don't worry, we are going to share some resources in case you have questions regarding your unique situation, where to go for help. So Medicare eligibility. Medicare is health insurance for people 65 or older, and certain people under 65 with disability, or people of any age with end-stage renal disease. And as I shared earlier, Medicare has different parts to cover specific service. And by the way, Medicare doesn't cover everything. Um, if you have Medicare, you will be surprised to receive a statement from Medicare after you see a doctor or a specialist that how much they cover and how much they don't cover. So keep that in mind. Medicare does not cover everything. So Medicare Part A, or what we call hospital insurance, helps cover inpatient care in hospital, including critical access hospitals and skilled nurse facilities. Medicare Part A also cover hospice and some home health care. Does anyone know what hospice is? Okay. And so beneficiaries must meet certain conditions to get this benefit. As I share, Medicare does not cover everything. And most people do not need to pay a premium for Part A because they or a spouse already paid for it through their payroll taxes while working. And generally speaking, people qualify for Medicare Part A for free once they got 40 quarters of working, meaning that got big tax for 40 quarters. So that's why Medicare Part B, most people don't need to pay for the and Part B is called, we also call medical insurance. It's it cover for like doctor services or outpatient care, and we also cover some other medical services that Part A does not cover. Something like services of physical or occupational therapists, and Part B cover some home health care, and Part B helps pay for this cover services and supplies when they are medical necessary. And some people pay a monthly premium for Part B. Part B, the premium is based on the income of the individual or the total income of the couple. So the higher income people have, the higher premium they need to pay for Part B. Part D is what we call prescription coverage, meaning that, when the doctor prescribe medication and when you go to the pharmacy, that's where Part B go in. And again, Part B doesn't cover every prescription. They have like a formula. And sometimes if the doctor prescribe a prescription that the drug is more expensive, the doctor needs to kind of explain why patient needs this more in order for Part B to cover for it. And so how do people get started? Medicare, sign up for Medicare Social Security administration. And that's the website. The website has different languages. So, the most easy and convenient way to sign up for Medicare is through this website. Or if you prefer like in-person experience, then you can call 1-800-772-1213 to make an appointment. But just want to give you a heads up. The number is very, very, very busy. Sometimes people need to wait for over an hour in order to talk to a real person to make an appointment. And of course, you say, oh, then I want to show up at local Social Security Administration. Yes, you can do that. But nowadays, they have two lines. The line is for someone already have appointment. The other line is you need to wait. And whenever they have time after they leave those people with appointment, that they can see you. So I think you don't want to wait there like all day. Sometimes it's so crowded, you don't even have a chair to sit. So I think the best way is to go online to sign up for it. So if you are over 65 or turning 65 in the next 3 months and now already getting benefit from Social Security, you need to sign up to get Medicare Part A and Part B because you will not get Medicare automatically. So what does that mean? We have 3 months before you reach 65 and 3 months after you reach 65. So basically you have 6 months to sign up for Medicare, and you have to sign up during those 6 months. Otherwise you will get penalty. So for example, if my birthday is January 1st, right? So I have January, December, November, October. I can sign up for Medicare 3 months before January 1st or before and after. So 6 months is pretty, a good leeway time period for people to sign up. So I strongly suggest people to sign up 3 months before, because if you forgot, then you still have 6 months to remember. So 6 months, okay, I'm sorry, 3 months before your 65 birthday, and do it definitely before, after 3 months when you reach 60. And so if you already get benefit from Social Security, you will get Medicare Part A and Part B automatically when you are first eligible and do not sign up. What does that mean? So for example, if I work, but I want to get my Social Security benefit earlier instead of my requirement uh, retirement age at 67. I said, okay, no, I want to get the Social Security benefit earlier when I am 62. That's the, like, people can get Social Security benefit at age 62, but the amount will be much less than, 67, for example, my, for retirement age. Okay, and I want to get Social Security at 62, right? But I'm still not eligible for Medicare, right? Because Medicare is only eligible yet. So I have 3 years to wait for Medicare. But what this means is if I already apply and have been getting Social Security benefit, then because Social Security Administration already have my information, so I will get Part A and Part B automatically when I become 65. So that's the difference, right? Is it clear? Like someone have Social Security benefit before 65 and someone wait until the requirement required retirement age. So there's and Medicare, once you sign up, Medicare will send you a welcome to Medicare packet 3 months before you turn 65. And you will have other important deadline and action to take. So read all the materials in the packet. But very important to read all of them because it does show under Part A what cover, what doesn't. Same thing, Part B and also take time to read the packet. Do you 3 months before your birthday and 3 months after? Yes. So you have the leeway is really good, 6 months. So that's why people will get penalty. They don't sign up with because because government think, oh, 6 months is long enough, right? If you forget. Say it again, I'm sorry. I It all depends on you know we try to get the answer, but we can never get the answer. So we were told that we were told to encourage people to apply 3 months before they yes yes so that if Social Security Administration they still have 6 months to and Part B. I think to enroll Part B is an important decision. Why? Because Part B people need to pay for the um, what type of coverage you have now, and then whether you can sign up later without penalty. Okay. And Part D, if you decide not to get Part D when you first are eligible, you will like to pay late enrollment penalty if you join later. So generally, you will pay this penalty for as long as you have Part coverage. To get Part D, you must join a Medicare plan that offer prescription drug coverage. Okay, so I think we already have a sense that, okay, Part A for most people are free because most people work, 40 quarters. Part B, yeah, qualified, but I need to pay for premium depends on my income or the incomes that me and my husband have. And of course, Part B. Exactly. So we are going to cover like they are going to cover for those. No, you need to have everything. You cannot say, oh, I don't. uh, I'm sorry. Can you please, do you mind if save the questions? Yeah, yeah. So because I want to share, yeah, yeah. I want to share all the materials with you, and then we can have questions and have discussion all together. Like I'm here only that like yeah. So how to apply? Like emphasize again, um, your first chance to get Medicare, usually start 3 months before your 65 birthday, and then ends 3 months after turning 65. So I always tell my just forget about the month after. Just remember 3 months before I turn 65. Here it's safer so that you never miss it. You never miss, to go for Medicare. So you can only enroll Medicare at certain time. Okay. 7 month initial enrollment, between January 1st to March 31st each year. And special circumstances will put in action. And the cost can go up the longer you wait, sign up. So getting Medicare late can mean lifetime premium penalty and delay in when when you are covered for get. So again, we don't want to take them unnecessary for the rest of our life, So just keep that in mind. And Part B, deciding to enroll in Part B is an important decision. It depends on what type of coverage you have now and whether you can sign up later. Why? What does it mean? If someone like works for a private company, okay, when the person works for the private company, of course, he will have all the right. But if he becomes 65, then he needs to sign up 3 months before he turns 65 Medicare, right? Because he doesn't want to wait. And then once he enrolled in Medicare, because he already worked 40 quarters, right? So Part A is free for him, right? But we'll have this decision to make. But if I sign up for Medicare Part B, I need to pay premium, right? Because Part B is not free. But then my employer now offer health insurance, and my employee's health insurance will cover for Part B for like doctor visit. Why should I sign up for Part B to pay extra? No, you don't need to sign up if your employer still offer you health insurance and cover doctor visit. You can wait until like, okay, all right, I'm now 67. I want, okay, and I want to retire, and I already receiving Medicare Part A for the past 2 years, right? Now I want to retire, but my employer doesn't offer any health insurance after I retire. So before I retire, I can go to HR to ask them to give me a proof that after I turn 65, I still have Medicare. I still have part, I'm sorry, not Medicare. I still have Part B coverage through my employer. So I can take this letter to Social Security Administration and say, hey, look, it's not like I didn't want to sign up or I forgot to sign up. It's because my employer has been covering me for doctor's visit. And once that Social Security Administration sees that letter, they will say, oh, okay, and sign up for copy, and we are not going to penalize for the past 2 years that you didn't sign up for copy. So keep that in mind too. Need to ask. Medicaid is a state sponsored health insurance. Has nothing to do with Medicaid. Medicare is a federal program. If you are, because Medicaid is for, no, you don't pay Medicaid. Medicaid, no, you don't. Because Medicaid is for people who are low income. So you don't pay for Medicaid. You qualify for Medicaid because of your, so you don't pay for Medicaid. MEDICAID state sponsor, and you don't pay for that. Yeah. Okay. They will tell you when you apply for Medicare late, they will tell you, okay, because you come to apply for Medicare Part B, you are supposed, for example, you are supposed to come 3 years. So this is the penalty that you are going to pay going forward. They will tell you, they will tell you, they will tell you. We heard about that because every year actually they have not adjusted the premium for Part B for maybe 2 years, but yes, they did in the past years. The premium did go up, and we just don't know when. So same thing. Part D is prescription drug. Right? If you decided not to get Part D when you first have, you will like a, but Part B, same thing. You can have the HRs, whatever, say, look, I have having the prescription drug coverage from my employer, and they will waive the penalty. Okay, we are going to cover because Medicare actually have we are going to cover. So you will get your Medicare card the mail about 2 weeks after you sign up. Sometimes it's longer, especially after COVID. Yeah. So your card is included in your official welcome and choose your coverage. Okay. This is where I keep saying there are two types of Medicare. One is original Medicare. That means everything go Part A, Part B, Part D come from Medicare. Okay, that's what we call original Medicare. But then I'm going to, there is another one. Sorry. There is another one, and I think people already heard about it, and there are articles recently to discuss about uh, Medicare Advantage. Medicare Advantage is Medicare, they contracting out to private insurance companies like Blue Cross and Blue Shield, like Cigna, like Pfizer, like all those private insurance companies to run Medicare for them. So Advantage Medicare, or sometimes people call Medicare Advantage. Um, so that's why I say there are two kind of Medicare. One is original Medicare. You got everything through Medicare. But then the other one is Medicare Advantage or Advantage Medicare, Medicare contracting out to those private companies to do all the coverages. Yes. As a private insurance company, they said they are okay. So this is the tricky part. Medicare Advantage, they advertise, those private insurance companies, they advertise said that the premium that you pay is much less compared you pay for original Medicare. However, there's a catch. You cannot go to see any doctor you want to see. Everything needs to go through your primary doctor. And it's very complicated because each insurance company they make like 10, 20 options for you to choose. And of course, the options, if you want more coverage, you pay for more premium. So my personal take, and I has nothing to do to against those insurance, like private insurance company, but we know private insurance company, what's their goal? Their goal is profit. So personally, I would not choose Medicare Advantage over original Medicare, even though I know I may need to pay premium more if I choose original Medicare, because why? I can go to any doctor I want, as long as that doctor, as long as that specialist take Medicare. And I don't need to like go to the private insurance company website to figure out, okay, how much I want to pay and what's the best coverage I can get. It's so confusing. I encourage you to go to any big insurance company. Well, you will find they have a category like Medicare Advantage. Once you go to their website to see, I believe you will be like me, get lost. Thank you for coming. It's so confusing. Those private insurance company, it's so confusing. No, you still have copay. You still have copay. Just like you are like, I'm assuming you are working, okay? Just or when you were working, when you go to see the doctor, you still have copay. But it gives you more freedom. Yes. And plus, to be honest, if government and private insurance company, who do you think will take care of people more? Well, in general, do you think a private insurance company would want to earn more money, or do you think the government? Yeah, so that's why personally, I will go with original Medicare. I would not go with the private company. What you need to do when you turn 65, you need to choose Medicare no matter what. Yeah. No, no, but you want to have Medicare because your employer will tell you, hey, you are 65. Your primary insurance should be Medicare, not us. We are your secondary or what they call supplement insurance. So that's why even you are 65 and you are working, you need to have Medicare. Yeah, yeah. Did they tell you why? Medicaid. Are you talking about Medicaid? Like the not the federal, not Medicare. Medicaid, I think, because I heard, I'm not an expert in Medicaid, because Medicaid is even more complicated. I think, I am sure that every certain year, you need to do the recertification for Medicaid. Probably some information change your qualification. So I would encourage you to make an appointment. You should have a case manager because every Medicaid recipient has a case manager. You should call your case manager and ask why they use that Medicaid. Yeah. So original Medicare includes Part A and Part B. So you can use, like I said, you can use a doctor, go to see the doctors and specialists. They give you freedom as long as the specialist or doctor take Medicare. The Medicare is like a federal health insurance program. So I don't think any doctor would say, oh, I'm not taking that. Um, and so if you want drug coverage, you can join a separate Medicare prescription drug plan that is part. See that because Part A and Part B, they are related to medical stuff. Okay, one is hospital coverage, one is doctor's office separately, that a separate entity because it's covered drug, not cover like when people need to do a surgery at a hospital or when people need to visit their doctor at the office. So that's why. People say, oh, no, I just want one part A and part B, but then one part D, they separate. Well, because first is your doctor prescribe, um, not that you directly deal with medical. So the doctor should have better idea. My son is a physician. So the doctor should have better idea, no, because they deal with this every day, like every day. What kind of drugs that my patient. So doctor should know what drugs covered by Medicare. If Medicare doesn't cover for certain more expensive drugs, the doctor should be the one who advocates. So I would suggest you go back to your doctor. Sometimes it's really not Medicaid problem. And but then we are not blaming physicians because they have to. So if we take charge of all our benefits, if I were you, I would go back to my doctor and say, hey, doctor, Medicare doesn't cover drugs. Can you prescribe anything that Medicare? Are you talking about Medicare or Medicaid? Okay. So are you asking which which health which private health insurance is better? I don't know because I only have one insurance company and I never deal with other private insurance companies, so I don't know. I don't know whether they are good or not. Yeah, it's hard to I really don't know because I don't have experience with all the private health insurance companies out there. That's a Yeah, that's a great suggestion. That's a great suggestion. Yeah, yeah. So to help your out-of-pocket costs in original Medicare, you can also shop or buy a supplement uh, coverage like Medicare supplement insurance. Okay, so what does this mean? Because we know Medicare doesn't cover everything, right? And I am sure if you already have Medicare, you must in your lifetime already get statement from Medicare telling you we don't cover this item. So what happens if who is going to be responsible for those items that Medicare doesn't cover? It would be you. But then if you have a secondary or sometimes people call supplement insurance, then your supplement or secondary insurance pick up whatever Medicare doesn't cover. Yeah. So for a real case, um, your case, sorry, I give you take you an example. For him, now you are still working, right? Okay. So once you retire, 67, 24, oh, you're so young. Okay. just just for example, he retired now. He's 67, and when he worked, when he was 65, he had Medicare as his primary insurance, right? But he also has his employer insurance as the secondary, right? But then now he retired. Does your employer offer health insurance after you retire? You're too young to know. Okay, so if her employer doesn't cover any retirees for the health insurance, then Ari probably it's a good idea for him to go out, shop around for the supplement or secondary health insurance. His employer doesn't cover retiree any health insurance. So this is what it means. Because at the very beginning, we already knew that Medicare doesn't cover everything. So whatever Medicare doesn't cover, it's either your responsibility or it's the secondary or supplement health insurance responsibility. There is a specific form, but don't worry about it. You just tell them, hey, I am 67 and I have been working after I turned 65. Now I want to retire. I want to get Part B. Every HR knows. Every HR. The form is very long, the name, so that's why I never able to. But just if you mention this, I want a letter to get. Oh yeah, yeah. No matter how old, like yeah, as long as you turn 65, you are still working, you are still getting insurance from your employer. If you, it doesn't matter if you retire at 66 or 70, get that letter so you don't get penalty for the rest of your life. So this is what we call Medicare Advantage. Remember, Medicare has original Medicare and Medicare Advantage. Those are like the contractors um, that government give out. They will tell you, oh, you think if you come to join us, you can part A, Part B, Part D. Not only that, you are going to get vision, hearing, and dental. Make it sound so wonderful, right? I pay less, but I get more. Sounds like. But always remember, there is no free lunch. There always it has lunch. Yeah, it's so hard because each individual situation is so unique. And I know a lot of people like you, like when they were younger, they were like, oh, I don't need Part B. But it's the fact that when people age, they probably need more medical care. So yeah, so it's really depends on the individual. Um, so when you make the decision whether to get Part B or Part D, don't don't think like don't look at the decision. Don't make the decision based on which way you want, but think about maybe 20 or 30 years later. That probably will help you to make a more informed decision. And I know a lot of my older friends, they are in this position. Do I want to get Part B now? Yes, I think I do because a lot of items, even though like doctor's visit, Medicare just doesn't cover. But then if I choose Part B now, I will have penalties. And the penalty is like a lot. So um, I encourage you when you make the decision whether to get Part B or Part D, don't make the decision based on where you are now, but where you possibly will 20, 30 years later. I depends on your income because remember Part B, yes. So they will, it's a lot. Yeah, it's a lot. Yeah. So so that's what Medicare Advantage. Want to sign up for Medicare Advantage? Please? There's no free lunch. And so plan might have lower out of cost than original Medicare because that's their selling point. Oh, our premiums are much cheaper than Medicare, but then again, there is a catch. In most cases, you will need to use the doctors who are in the plan network, which means you don't have freedom to choose the specialist. You know, oh, a specialist, from the review from everyone say this specialist is really good in doing this type of surgery. But then if he is not in, for example, Aetna, then not go. You are under Medicare. And how does Medicare work with other insurance? So when you have other insurance, there is more than one pair of your coverage. So that's what we just share. If you have Medicare and items that Medicare doesn't cover, it's either you or your secondary or supplement health insurance pick up those costs. And complete your year one Medicare checklist. Okay. Make sure that you talk to someone that you trust about your Medicare. Fill out an authorization form to give Medicare permission to talk with someone that you trust and you choose. Because um, Medicare is so complicated. If you have someone you trust and can ask the question for you or can go with you to clarify the question, it is better. So fill out the authorization form for someone you trust can talk to Medicare on your pay. And also when you get welcome to Medicare, preventative visit appointment during the first 12 months, you have Medicare, it's free. So once you get Medicare, the first preventative appointment within the first 12 months is free. You don't need to pay. So keep that in mind. And learn what else Medicare cover. That's why I said when you get the welcome packet, it is so important. I know it's thick, the book is thick, but go through page every page. You don't need to go through everything in one day. You can break it down, but make some notes, what cover, what doesn't cover in Medicare. And you can create, once you sign up, when you sign up for Medicare, you will have an online account with Medicare, and then you can go there to check, what item already been covered, what's not covered. You can get all your personal information and for coverage plan. And yeah, there are a lot of things that you can do with your online, that like pay your Medicare premium, your original Medicare claim, stay on process. So I encourage you to go online to apply for Medicare, and then once you have, it's much easier to go online to check everything about your account. That's a good question. So if you receive Social Security benefit, they would deduct, yeah, from automatically. Yeah, they would deduct. But if you still too young to or you decide, I am qualified for Social Security benefit, but I don't want to, claim it because I want my Social Security benefit, the number, the payment to be higher. And then, you just, so here, are the website that you can take a picture. You can go to get more resources about Medicare. Yeah. That's a good question. I heard, but call Medicare because I heard they don't. It would be out of pocket because Medicare, remember, uh, when people go to see doctor, those doctors participate in Medicare. And I'm sure doctors in your country, they don't participate, right? So that's why Medicare doesn't cover. You, well, that's a good question. I don't know either because this is the first time people ask me this question. But I would definitely write down all the questions that you have about Medicare and the coverage, and then make an appointment. Yeah, because everyone's situation is different. Um, I think that's the best way to know what happened. Yes, I'm sorry. Uh-huh. Mhm. Well, I think before I say I encourage, I didn't say I encourage. I say personally, I would choose original that tradition, meaning you no, meaning I don't choose Medicare Advantage, meaning I don't go with those private insurance companies. And again, I want to clarify, I didn't encourage you not to, but I said personally, I will go with original Medicare. Yeah. Medicare original, yes. Yeah, you do. You have no choice once you sign up for Medicare Advantage. Yeah. You mean original Medicare? For original Medicare, I don't think for original Medicare, okay, not for Medicare Advantage. No, first of all, why they don't cover, why they don't apply for Medicare? But then Medicare Part A is hospital coverage is automatically once people work 40 quarter. So there's no reason not to apply for Medicare because if the person already worked 40 quarters, Part A, the hospital coverage is automatically guaranteed. Yeah, I'm glad you mentioned hospital social workers. Hospital social workers is the person that the hospital billing department will send patient to them. Most likely because the patient cannot pay for the cost. The hospital social worker should have all the resources direct the patient to go where to get help. That's one thing. The other thing is actually patient can negotiate directly with the hospital because this is an open secret that hospitals charge much more for patient with insurance. Okay, they use the formula of how they charge. They apply to people without insurance. So patient, it's patient's right to negotiate with hospital directly about the bill. For example, hospital charge patient with insurance, a Q-tip, okay? A Q-tip. They can charge a Q-tip, not a box of Q-tip for 3.5. What? So, and when people have, they don't care, right? Because for that, if someone who doesn't have so we prepare strongly advocate for yourself. You need to have a lot of time and person. Look, I know it's reasonable that you need to charge me a tip because that's what was needed during the surgery or after or whatever. But I don't think a Q-tip others can do handle it. So you need to go like item by item to negotiate with them, and that's your right. That's all. No, that's all normally after you are discharged when they send you the bill. But no, that's not what I'm saying because at that time you are patient. Anything that can help you medically, you don't say no. You don't say no because your health is priceless. Yeah, if you don't have Part D, then um, you pay. Uh, yes, every medicine prescribed by any of your doctors, you pay for it. And you don't want to pay for drugs in the state because it's so expensive. I don't know. Beyond that was when they like I don't even know, like maybe when first when Medicare first being designed and being made into law, they don't cover it because maybe 40, 50 years ago, the situation in general were much different than now. So that's why later on they add Part D. But initially, why they don't cover for Part D, I don't know. Oh, that's what I keep saying. Medicare doesn't cover everything. Medicare doesn't cover everything. So that's why, people normally get the secondary or supplement health insurance. So that when Medicare doesn't cover the item, the secondary or the supplement insurance pick up those. Yeah. Well, depends on that. If you have the secondary insurance covered drugs or not. It's not like 80, no, it's not 80 or it all depends on the item of service. That can be true because they will say because that's they see Medicare as the primary. Okay. But then wait a second. I don't think that's the truth. I don't think that's the case. What 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 insurance, what private, what secondary insurance? Uh-huh. Well, actually, I want to say again personally, I'm not encouraging you or discouraging you to get Medicare Advantage, but I think that's why, from the simplicity point of view, from the more generosity point of view, it's better to have original Medicare. And I want to say, if for, for participants who don't have questions, you are welcome to do the QR code. And I'm sorry, can you hold your question? I'm going to show.
If you need help, you can raise your hand and I'll come over to you. If you need help with the form, just raise your hand and I'll come over to you. It's a, the QR code on the screen. It's for a survey that we have to take. Yes. So it's not signing up for Medicare. This is not the Medicare side. You got to go that at home. But this is the evaluation to sign up the survey. So if you use your phone, yeah. Again, if you need help, just raise your hand and I'll come over to you. Go ahead, Tantawati.
Sorry, she raised her hand. Good morning. Say it again. I think that's scam. I can tell you. They don't. No, no, no. A lot of time. No, it's okay. Just want to do some advertisement. We have another, and I sent you the game for all the adults. I sent you the email. And we have another presentation focused on scams for older adults. I encourage it's an online presentation. We have a link that you can register because there are a lot of scams nowadays by people calling your phone number, calling your cell phone number, texting you, email you, and even say, "Hi, Uncle Yan, how are you doing?" My husband got that kind of scam a lot. So if you could, please join us. It's on December 10th. Government never.
Maksudnya di gini, habis info sesi ini nanti beliau dari county itu ada program namanya supaya kita understand apanya mas scam. Bapak-bapak, ibu-ibu sadar nggak? Scammer itu banyak sekarang. Ada yang bilang, oh tolong kayak Facebook account saya di hijack. Facebook account saya karena itu ada scammer. Caranya macam-macam, dari SMS, ada yang minta WhatsApp, kita tanpa sadar kasih respon SMS kita respon WhatsApp orang kita nggak kenal, itu scammer. Dan dia bisa masuk ke dalam Facebook account kita. Ya. Nah sekarang kalau di sini macamnya banyak macam. Nanti ada yang bilang, Bapak dan Ibu, saya dari Medicare Administration. Kayaknya Bapak dan Ibu udah eligible untuk apply for Medicare. Oke. Tapi itu bisa juga scammer. Kita nggak tahu. Jadi scammernya ini nanti setelah ini kami akan share kami akan berikan link ya untuk join sesi ini ya. I think through Zoom, right? Webinar. Iya, Zoom ya. Jadi nanti join. Nanti kita akan buat info sesi kita bantu ya kalau perlu translation nanti juga kita siapkan. Tapi ini bagus karena ini awareness yang terjadi banyak adalah pada segmen senior. Kenapa? Kebetulan kerja saya di IT, jadi saya pun masih harus masuk training security kayak begini. Jadi saya understand ini yang sebenarnya kita kemarin tahun lalu dengan AHI program itu kita mau cari sesi ini, ternyata mereka sudah siapkan sesi ini. Jadi alhamdulillah ini sangat-sangat bermanfaat dan Bapak dan Ibu kalau bisa build awareness karena sekarang iPhone atau smartphone tanpa sadar ini kita bisa vulnerable ya, sangat vulnerable dan kita nggak sadar. Jadi beliau menganjurkan kita nanti join sesi setelah ini ya. Terima kasih.
All right. Okay. Thank you so very much allowing me to spend Saturday morning with you. Thank you.